That's interesting that you'd say this because I want people to also know about this recommended daily allowance, RDA, which is when you see on the bottles, when the multivitamin says 100% of, let's say, vitamin E or vitamin A or C, I don't want people to think that if they take 1,000%, that that's going to be 10 times better for you. And as you said, when you take too much vitamins, you can have more side effects and more harm. And I want people to pay attention to this. Too much vitamin A, liver toxicity, a lot of damage. Pregnant women that take vitamin A, they have birth defects. So don't think more vitamins is better for you. Am I right here?
Yes, exactly. Yes. We tend to have the more is better philosophy in this country. We all have a tendency to want to kind of dose ourselves with just a little bit more in hopes it's going to make us that much more healthier in the long run. But if you want to take a vitamin supplement, a multivitamin supplement, then if you take it at 100% of the recommended dietary allowance, that's fine. It is not necessarily going to improve your health that much greater. And in fact, recent studies have shown that taking a multivitamin supplement really does not do anything for you much at all. But don't think that by going above and beyond that 100% of the RDA is going to make you that much more healthier. That's where people don't realize that if you get it too high, then the vitamin begins to act more like a drug in the body as opposed to a vitamin. Because vitamins fall into two categories. You have water-soluble vitamins and you have fat-soluble vitamins. The water-soluble vitamins are your B vitamins and vitamin C. They tend to be excreted from the body because we don't store those vitamins. We do need them on a daily basis. But the fat-soluble vitamins, which are vitamins A, D, E, and K, they are stored within the fatty tissues and in the liver of the body. So we don't necessarily need to be taking them on a daily basis as far as, food we're getting in. But if we're taking a supplement of them in a high-dose supplement, yes, that can do a lot of internal damage to the liver, various other things that can go on. So people just need to be aware that more is better is not the philosophy to use when it comes to taking vitamin supplements.
Okay, so I agree with you. I think, people need to know that there are about 13 vitamins, but there are also about 85,000 supplements. A lot of these are not being regulated by FDA. Mm-hmm. And as we saw recently in one of these weight loss, medications and herbs that's out there, the vitamin shops are actually taking them off the shelf because they found that there were a lot of other things that FDA didn't even bother to tell them, and there are a lot of side effects with this. I also worry about the interaction of some of these supplements with the drugs and prescription medications, that people take vitamins on their own and they can interfere. We just saw vitamin E and A actually can interfere with chemotherapy. And so on and so forth. In my field of prostate cancer, we've seen that vitamin E, actually taking a lot of them, increases the risk of prostate cancer by 17%. So I'm not for a lot of these. I think that if you're a vegetarian, taking vitamin B12 perhaps is necessary. I think that if you are have chronic bowel disease, you have Crohn's, you have inflammatory bowel disease, maybe you're not absorbing and you should be taking them. If you have gone through like some sort of a gastric bypass and you've had surgeries, etc., that I can make a sense out of this. But when we come back